Hi, I'm Ramya Walsan. I'm from the Australian Institute of Health Innovation at Macquarie University. We recently published our paper titled Characteristics of Patients Accessing Outpatient Oncology Services and the Predictors of Their Subsequent Unplanned Emergency Department Visits among 78,323 adults with cancer living in Australia. Our study looked at virtual care use among patients accessing oncology services in Australia. Since the COVID-19 pandemic, virtual care has become common in cancer services. But we still need to understand which patients are using it, who may be missing out, and how virtual care relates to other health service use, such as unplanned emergency department presentations. So we used linked health data of over 78,000 adults with cancer living in Victoria and Queensland. Our study found that virtual care is not equally used among patient groups. Patients living in rural areas and those with greater healthcare needs are more likely to use virtual care. But older patients and patients born overseas were less likely to use virtual care compared to younger adults and Australian-born individuals. We also found that virtual care use was associated with higher unplanned emergency department presentations. But this does not necessarily mean that virtual care caused these visits. It may reflect that patients using virtual care more often have complex healthcare needs. For me, the main message is that virtual care should not be seen as a simple replacement for in-person care. It should be carefully designed and integrated into the broader cancer pathways. That means supporting patients with complex need while reducing barriers for those who find virtual care harder to use. We submitted this paper to JMIR because the journal is a strong fit for research on virtual care, digital health and health service delivery. We also wanted to reach clinicians, researchers, policymakers and health system leaders who are thinking about how virtual care should be used beyond the pandemic. Thank you.